All right, get ready to dive into something a little different today. We're tackling a medical mystery that's way more common than you might think. Thyroid nodules. You know, those little lumps that can pop up in your thyroid gland. You sent over a stack of medical journal articles on this topic, and let me tell you, I was surprised by just how many people actually have these things, just lurking in their necks, often without even realizing it.
Yeah, it's true. They're incredibly common. And, while most of them are totally harmless, that nagging question always lingers in the back of your mind. Like,
Yeah,
what if mine isn't?
right.
That's what makes this deep dive so important. Understanding how doctors figure out if a nodule is something to worry about or not.
Okay, so let's set the scene here. Imagine you're at the doctor's office.
Yeah.
And you just found out you have a thyroid nodule. What happens next? It's like we're stepping onto the first tile of a choose your own adventure game.
Well, the first step is a bit like a detective gathering clues. Your doctor will start with a thorough history and physical exam, asking about things like family history of thyroid cancer, any past radiation exposure, and of course, any symptoms you might be experiencing.
So even seemingly unrelated details could be important pieces of the puzzle, huh?
Absolutely.
Right.
And then comes the hands-on part. Your doctor will actually feel the nodule, checking its size, shape, and whether it moves freely or not. Believe it or not, this simple act can reveal a lot.
So like a detective feeling for secret compartments in a wall.
Exactly. Some nodules are firm and fixed, while others are soft and mobile. Some grow quickly, while others remain stable for years. These subtle differences can offer valuable clues.
Okay, so we've got the initial investigation, the gathering of clues. But I imagine doctors don't stop there, right? It's time to bring in the high-tech tools.
You got it. The next step usually involves a blood test for something called thyroid stimulating hormone, or TSH. Think of TSH like a tiny conductor in your bloodstream, directing the thyroid gland to produce more or less thyroid hormone.
Okay, so TSH is the boss telling the thyroid how much hormone to pump out. But how does this relate to nodules?
Well, sometimes a nodule decides to go rogue and start producing thyroid hormone on its own, without waiting for instructions from TSH. These overachieving nodules are called hot nodules, and they actually suppress TSH levels, making it a valuable clue for doctors.
So a low TSH level is like a red flag signaling that something might be up with the nodule. But what if TSH is normal? Does that mean you're in the clear?
Not necessarily. A normal TSH just means the nodule isn't going wild with hormone production. It doesn't tell us whether it's benign or cancerous. That's where imaging comes in, usually starting with an ultrasound.
Ah, yes, the ultrasound. Everyone associates it with pregnancy, but it makes total sense for visualizing a nodule too, right? Like a sonogram for your neck.
Exactly. And it's way more sophisticated than just confirming the nodule's presence. The ultrasound reveals all sorts of details about its size, shape, and composition. Is it solid or cystic? Does it have smooth borders or irregular ones? Are there any tiny calcium deposits? These features can provide crucial insights into the nodule's personality, helping doctors assess its risk of being cancerous.
Wow, so the ultrasound is painting a portrait of the nodule, revealing hidden details that you could never feel with your fingers alone. It's like having X-ray vision for your thyroid.
It really is. And based on what the ultrasound reveals, the doctor might recommend another imaging test called a thyroid scan.
Hold on, a scan. Didn't we already do that with the ultrasound?
Not quite. The ultrasound uses sound waves to create an image, while a thyroid scan uses a small dose of radioactive iodine.
Wait, radioactive. Should I be worried?
Not at all. The amount of radiation is very low, and the benefits far outweigh the risks. The thyroid scan is particularly useful for figuring out if a nodule is hot or cold.
Okay. You're going to have to remind me about those hot and cold nodules. I'm picturing an ice pack and a heating pad on someone's neck.
I know, the terms sound a bit funny, but it all comes down to function. A hot nodule, remember, is hyperfunctioning, meaning it's taking up more of the radioactive iodine and producing excess thyroid hormone. These hot nodules are almost always benign, which is great news.
Okay, phew. So hot nodules are usually nothing to worry about, but what about the cold ones?
Cold nodules are the quiet ones. They're non-functioning, meaning they aren't producing excess thyroid hormone. While some cold nodules are benign, they're more likely to be cancerous than their hot counterparts.
I see. So the thyroid scan helps doctors separate the overachievers from the wallflowers. And the cold nodules tend to raise more suspicion. But how do they know for sure if a cold nodule is cancerous?
That's where the gold standard of thyroid nodule evaluation comes in, the fine needle aspiration biopsy, or FNA.
Okay, I know the word biopsy can sound scary. Can you break down what an FNA actually involves?
Sure, it's a very quick and relatively painless procedure. That can be done right in the doctor's office. A very thin needle is used to extract cells from the nodule, and often it's done with ultrasound guidance, which makes it even more accurate, especially for small or hard-to-reach nodules.
Okay, so it's not major surgery or anything, but what happens after the cells are collected? What are the doctors looking for?
The cells are examined under a microscope by a pathologist, and the results are categorized based on what they see. It could be benign, meaning non-cancerous, or malignant, meaning cancerous. But there's also a whole spectrum of results in between, which is where things can get a bit more complicated.
Oh, those in-between results sound tricky. So we've got the initial investigation, the blood work, the imaging, and now this FNA with its possible gray areas. Where do we go from here?
That's a great question. And that's exactly what we'll be exploring in the next part of our deep dive. We'll unpack those indeterminate FNA results and discuss how doctors use cutting-edge molecular tests to get a clearer picture.
All right, listeners, we're going to take a quick pause here, but don't go anywhere. When we come back, we'll delve deeper into those fascinating molecular tests and explore the various treatment approaches for different types of thyroid nodules. This thyroid mystery is just getting interesting.
Definitely.
Welcome back, listeners. Before the break, we were hot on the trail of our thyroid nodule mystery, and things were getting pretty interesting. We left off talking about the fine needle aspiration biopsy, or FNA, and how it can sometimes deliver those tricky, indeterminate results. It's like the detective finds a mysterious fingerprint at the crime scene, but it doesn't quite match anyone in the database.
That's a great analogy. And just like detectives have advanced forensic tools to analyze those fingerprints, doctors have some cutting-edge technologies at their disposal to decipher those indeterminate FNA results.
Okay, I'm all ears. Tell me about these high-tech tools. What are we talking about here?
One of the most exciting advancements is the field of molecular testing. These tests analyze the genetic material within the nodule cells, looking for specific clues that can help distinguish between benign and cancerous growths.
So it's like peering into the DNA blueprint of the nodule, searching for telltale signs, right?
Exactly. One approach is to look for specific gene mutations that are known to be associated with certain types of thyroid cancer. For example, mutations in the BRAF and RAS genes are often found in more aggressive forms of thyroid cancer.
So if those mutations are present, it significantly raises the red flag.
Absolutely. It's like finding a smoking gun at the scene. But even if those specific mutations aren't found, it doesn't necessarily mean the nodule is harmless. That's where another type of molecular test comes in, one that's even more sophisticated. It's called mRNA expression analysis, and it's truly revolutionizing the way we evaluate thyroid nodules.
Okay, I'm officially intrigued. mRNA, that sounds familiar from the whole COVID vaccine world. But what does it have to do with thyroid nodules?
Great question. You see, DNA is like the static blueprint of a cell, but mRNA is like the dynamic messenger, carrying instructions from the DNA to the cell's machinery to produce proteins. By analyzing the patterns of mRNA expression in a nodule, scientists have developed something called a gene classifier.
Gene classifier? That sounds pretty intense.
It is. Think of it like a highly trained algorithm that's learned to recognize the subtle differences in mRNA expression between benign and malignant thyroid nodules. This classifier can analyze over 160 genes within the nodule, creating a molecular signature that predicts the likelihood of cancer with a high degree of accuracy.
Wow, so it's like this test can see a much more complete picture of what's going on inside the nodule at a molecular level, rather than just looking for a few specific mutations.
Exactly.
Mm.
And the beauty of this technology is that it can help avoid unnecessary surgeries. In the past, many patients with indeterminate FNA results ended up going under the knife just to be safe. But now, with these molecular tests, doctors can be much more selective, reserving surgery for those nodules that truly pose a threat.
That's amazing. It's like these molecular tests are adding a whole new dimension to the detective work, helping us get to the truth with more precision than ever before.
They truly are. And the field is constantly evolving, with researchers working on even more refined and accurate tests. It's an exciting time for a thyroid nodule diagnosis and treatment.
It sounds like it. But let's not forget about those nodules that are discovered by accident, those incidentallomas we talked about earlier. You know, the ones that pop up on a scan for something completely unrelated. It's like finding an unexpected treasure buried in your backyard. What happens in those cases?
It really depends on the context. Most incidentallomas are small and harmless, and they can simply be monitored over time with periodic ultrasounds. But sometimes these accidental discoveries warrant a closer look. For instance, nodules found on PE scans, which are often used to detect cancer, tend to have a higher risk of being malignant themselves.
So it's like finding a suspicious package in the mail. You might be tempted to just ignore it, but sometimes it's better to err on the side of caution.
Exactly. And the same goes for nodules found in people with a history of childhood radiation exposure to the head or neck. Radiation can increase the risk of thyroid cancer, so those nodules need to be carefully evaluated.
Okay, so we've got those incidentalomas, and we've got those hot nodules that are pumping out extra thyroid hormone. We talked about those earlier, remember? How are those typically managed?
It all comes down to whether they're causing symptoms or not. If a hot nodule is producing so much thyroid hormone that it's pushing the body into overdrive, a condition called hyperthyroidism, then treatment is usually necessary to rein things in.
What kind of treatment are we talking about?
There are a few options. One is medication that blocks the production of thyroid hormone, essentially putting a damper on the nodule's overenthusiasm. Another option is radioactive iodine therapy, which uses a targeted dose of radiation to destroy part or all of the thyroid gland. And of course, there's always surgery, which involves removing the nodule or, in some cases, the entire thyroid gland.
So it's like having different tools in the toolbox, each with its own pros and cons.
Exactly. The best approach depends on the individual patient's situation, taking into account factors like their age, overall health, and personal preferences.
And if a hot nodule is just chilling out, not causing any trouble.
Then watchful waiting might be the most appropriate approach. The doctor will monitor the nodule over time, checking to make sure it's not growing or causing any problems.
Got it. So it's all about assessing the individual situation and weighing the risks and benefits of different treatment options. But what about the psychological side of all this? I imagine receiving a diagnosis of a thyroid nodule, even if it's benign, can be a pretty stressful experience.
You're absolutely right. It's a lot to process, and it's completely normal to feel anxious or overwhelmed. The uncertainty of not knowing whether a nodule is cancerous, the tests, the waiting for results, it can take a toll.
Yeah.
And even if the nodule turns out to be benign, there's often the ongoing need for monitoring, which can keep the issue at the forefront of your mind.
It's like this cloud of what if hanging over you, even after the initial crisis has passed.
Exactly. And that's why it's so important to have open communication with your doctor throughout the process. Don't be afraid to ask questions, express your concerns, and discuss your emotional well-being. Your doctor can provide reassurance, support, and resources to help you cope with the challenges of living with a thyroid nodule.
That's great advice. So we've covered a lot of ground today, from the initial evaluation to the high-tech molecular tests, from incidentalomas to hot nodules, from the physical aspects to the emotional toll. But I have a feeling there's still more to this story, right?
You're right, there's one more piece of the puzzle we need to explore. We've talked about nodules that are solid, but what about those that are filled with fluid? Those cystic nodules can present their own unique challenges.
Ah, yes, the cystic nodules. Those sound intriguing. We'll dive into those and wrap up our exploration of thyroid nodules after a quick break. Stay tuned, listeners. All right, and we're back, ready to finish up our exploration of thyroid nodules. Before the break, we were just getting started unraveling those fluid-filled culprits. Known as cystic nodules, it's like our choose-your-own-adventure game just took an unexpected turn.
They definitely add another layer of complexity. Cystic nodules are essentially little sacs filled with fluid. And while they might sound less threatening than their solid counterparts, they can still cause problems.
Okay, so they're not always so innocent. What kind of trouble can these fluid-filled sacs cause?
Well, sometimes they can grow quite large, causing discomfort or even
Oh.
difficulty swallowing. And they can also bleed, which can be alarming and even painful.
So even though they're not solid masses, they can still pack a punch. How do doctors approach these cystic nodules? Is it the same game plan as with solid nodules?
Not always. With cystic nodules, doctors often take a more conservative approach initially. They might simply monitor the nodule with ultrasound, watching for any changes in size or characteristics.
So a bit of a wait-and-see approach.
Exactly. But if the nodule starts causing symptoms, or if it shows signs of rapid growth or suspicious features on the ultrasound, then intervention might be necessary.
And what kind of intervention are we talking about? Is surgery the only option?
Not necessarily. Sometimes doctors can drain the fluid from the cyst using a fine needle, a procedure called aspiration. This can provide relief from symptoms and even shrink the nodule.
So it's like letting the air out of a balloon.
That's a great way to think about it.
Yeah.
But sometimes, even after aspiration, the cyst can refill with fluid in those cases. There's a procedure called sclerotherapy, where a special solution is injected into the cyst after aspiration, to help prevent it from refilling.
So it's like patching the leak in the balloon to keep it from inflating again. Pretty clever.
It is. But if the cystic nodule keeps coming back, or if it has concerning features on the ultrasound, then surgery might be the best option to remove it completely.
Okay, so even though cystic nodules often start with a more conservative approach, sometimes they end up on the surgical path just like solid nodules, you know? As we wrap up this deep dive, I'm struck by how much we've learned about thyroid nodules, the
Mhm.
different types, the evaluation process, the cutting-edge molecular tests, and the various management options. It's a lot to take in.
It really is. And I think the most important takeaway is that while a thyroid nodule diagnosis can be scary, the vast majority of nodules are benign and don't pose a serious threat to your health.
That's reassuring. But even if a nodule is benign, I can imagine the whole experience. The tests, the waiting, the monitoring can still be emotionally taxing.
Absolutely. The anxiety and uncertainty that comes with any medical diagnosis, especially one involving the word nodule, can be overwhelming. It's important to remember that you're not alone, and there are resources available to help you cope.
Like what kind of resources?
Well, for starters, don't be afraid to talk to your doctor about your concerns. They can provide reassurance, answer your questions, and offer guidance. And there are also patient support groups and online communities where you can connect with others who are going through similar experiences. Sharing your story and hearing from others can be incredibly empowering and validating.
That makes sense. It's like having a community of fellow adventurers to share the journey with, to offer support and advice along the way, you know? As we've delved into the world of thyroid nodules, it's become clear that this is a field where science is constantly advancing. Are there any exciting new developments on the horizon that give you hope for the future of thyroid nodule diagnosis and treatment?
Absolutely. Researchers are hard at work developing even more refined molecular tests that can provide even greater accuracy in distinguishing between benign and malignant nodules. And they're also exploring non-invasive imaging techniques that could potentially replace the need for FNA biopsies altogether in some cases.
Wow, non-invasive imaging. That would be a game changer. No more needles, no more biopsies. Sign me up.
I know, it sounds amazing. And while these technologies are still in development, they offer a glimpse into a future where thyroid nodule evaluation is faster, easier, and less stressful for patients.
That's fantastic. It seems like we're moving toward a more personalized and precise approach to thyroid nodule management, and that's great news for everyone.
It definitely is. And I think that's a perfect note to end our deep dive on. Remember, knowledge is power. And now that you've gained a deeper understanding of thyroid nodules, you're better equipped to navigate this journey with confidence and peace of mind.
Couldn't agree more. So listeners, remember, the vast majority of thyroid nodules are benign, and even those that require further attention are often very treatable. The key is to stay informed. Communicate openly with your doctor, and don't hesitate to seek support when you need it. And until next time, stay curious, stay empowered, and keep those fascinating sources coming.